Hi, Christine Morrow, Part 2 of Physical Examination, Patient DM. Now we're going to assess the jugular venous vein. So it's a little bit easier when the patient's head of the bed is 45 degrees. And we look at it on both sides. So usually the jugular is more distal than the carotid. And I don't see any pulsations. I'm looking at the other side. I don't see any pulsations. Things seem to be intact and symmetrical. Okay. Then we're looking at the precordium. So the precordium of the chest doesn't seem to be any heaves, which is like a lift. No pulsations or any visible pulsations. And then what I'm going to do is I'm going to palpate the fifth left intercostal space, midclavicular line. And I don't feel any thrills, and I do, it's called an apical pulse. I do feel a pulse. And I'm going to auscultate. And we're going to auscultate for 15 seconds. And normally with the apical, you listen for a minute. Listening for S1, S2 sounds. Rhythm is regular. It's about 64 beats per minute. Then I'm going to listen throughout for S1, S2 sounds throughout the aortic, the pulmonic, the tricuspid, and the mitral. So this is at the second right intercostal space, which is the aortic. The second left intercostal space, which is the pulmonic. The fourth left intercostal space, which is the tricuspid, and the fifth intercostal space, which is at the midclavicular line, which is the mitral valve. And then we'll use the beloboscope, again listening for rhythm, rhythm's regular. There's no extra heart sounds, no S3, S4. Aortic, pulmonic, tricuspid, and mitral. Very good. Okay, and then we've listened there. Okay, now we're going to go down to the, there were actually no murmurs either present. And we're going to actually go down to the abdomen. So the abdomen was previously assessed, and there is a lesion, or actually a scar, in the right lower or right upper abdomen. There doesn't seem to be any pulsations. The umbilicus is symmetrical within, or it's actually midline, and the skin is intact and a pinkish color. Okay, so what we do with the abdomen is we inspect, auscultate, percuss, then palpate. So I will begin by auscultating in the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. Vowel sounds are present. Usually you listen for about 5 minutes to declare if there's no vowel sounds, but vowel sounds are present. And then the aortic, we listen with the beloboscope, and there's no extra noises or bruits. Then we're going to percuss in a zigzag motion. 1, 2, 3. Any tenderness?
No.
Any tenderness?
No.
Any tenderness?
No.
Any tenderness?
No.
Okay, very good. And then we're going to palpate. Any tenderness?
No.
Any tenderness?
No.
Any tenderness?
No.
Any tenderness?
No.
Okay, so we've done our inspect, our auscultate, our percuss, and our palpate. Then we're going to move down to the hips. Okay, I'm just going to ask you to lift your left leg There is resistance. Very good. Now abduct, which is good. And adduct. Very good. Bend your leg. Okay. We're going to do internal rotation, external rotation. Very good. And down. And then the same. We're going to have to do up with resistance. Good. Out. Good. Resistance. In. Good. Bend your leg. Excellent. Internal rotation. Good. External rotation. Very good. And down. Very good. Excellent. And again, just do the abduct and adduct. Resistance and resistance. Excellent. Excellent. Okay. Now we're going to inspect the lower extremities. Okay. Lower extremities look symmetrical. Hair is evenly distributed throughout the legs. Inspecting, I'm going to palpate the popliteal and the posterior tibia. And if you can flex your, just show just move your leg up a little bit so we can show the camera. The dorsalis pedis, very good. And then the other side, popliteal and the posterior tibia and the dorsalis pedis. Very good. Temperature is warm and dry. There's no edema bilaterally, okay? And we can actually test the capillary refill for remember, it's less than 1 second. Less than 1 second, sorry. Okay, so now with resistance, I need you to dorsiflex, plantar flex, inversion, this way, good. Eversion, very good. Okay, same thing. Dorsi, plantar, inversion, eversion. Can you crinkle your toes or scrunch your toes? Good. Capillary refill is less than 1 second again. And then now we're going to have you do heel, slide your heel down your shin. Very good. Slide your other heel down your shin. Very good. And then we're going to test the Babinski reflex, which I'm just using a pen. Okay, a little ticklish, but now a little ticklish. Toes don't flare, but toes do not flare, so that means the Babinski reflex is negative because the toes are not supposed to flare. All right, very good. So now I'm just going to have you sit up again. Okay, decent strength here. Okay, and we're going to back this up a little bit because I need to see your knees. Okay, here we go. And all right, so now I'm going to ask that you flex and extend your knees. Good. Flex and extend. Very good. Good. Okay. All right, put them down. Okay, now I'm going to take my stethoscope and we're going to test for deep tendon reflexes, okay? Right here and right here. Very good. Usually it's about a 2, so there is movement there and strength. Okay. Then we're going to test right now for, all right, can you close your eyes and just tell me if you feel this?
Yes. 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 Yep.
Below. Okay,
Yes.
lift up your leg a little bit. Lift your legs. Lift there. Yes.
Yes.
Okay, other one? Yeah.
Yep. Yep. Can you put it on pause?
Nope, that's okay. Go ahead. Okay, then the next one is I'm going to have you test for soft or sharp. Okay? So tell me, is this, close your eyes.
Soft.
Good.
Sharp.
Good.
Soft.
Good. Again.
Sharp.
Good.
Sharp.
Good.
Sharp.
Good.
Sharp. Sharp.
Good.
Can't tell.
Okay. And
Soft.
and
Soft.
very good. Okay. Next, we're going to have you do what's called stereogosis. I need you to close your hand and give me your eye. Your hand, excuse me. And close your eyes. Okay, open your hand. Okay, close your hand. All right, can you tell me what that is?
A ring.
Very good. Okay. Now for the other hand. Okay. Close your hand. What is that?
Paper clip.
Excellent. Okay. Now give me your right hand. All right. Turn it. Okay. Now I want you to, I'm holding your middle finger. Close your eyes. I want you to tell me if it's up, down, left, or right. Ready, go.
Up.
Good.
Down. Right.
Good.
Left.
Excellent. Okay. And then next I want you to put your hands on your lap, and as quickly as possible, okay, I need you to flap them back and forth, like the back and the front, as quickly as possible. Good. Keep going, keep going, keep going. Very good. Okay. Excellent. All right. Now the last part we're going to have to just adjust, and I'm going to have you, as long as we can see him walk across the room. All right. I'm going to have you walk across the room. Okay. Good. Let your arms swing. Right. Turn. Okay. Now do heel toe, like heel to toe like this. Like put your heel in front of your toe, like you're walking the line for DWI. Good. Okay. And turn. Good. Okay. Now walk on your heels. Walk on your heels. Okay. Go back. Again. Okay. And walk on your toes. Walk on your toes. Tippy toes. Okay. Good. Stop. Okay. Now I'm going to, it's good. This is called the, so you can go flat. This, okay. Close your eyes. This is called the Romberg sign. I'm going to hold you, but I need you to just stand there for 20 seconds. Okay, very good. All right, now I just need you to bend forward. Bend forward. Good. Touch your toes. Upward. Okay. Side to side. Twist. Very good. Come next to the bed and do a knee bend on each side. Like one, or actually turn to the side one at a time. Good. And the other one? Good. Okay. Okay. Thank you very much for the exam.